WRCR.com.
The following program is furnished by its producer, host, and sponsors.
Good morning, WRCR listeners. This is Mark Brownstein from Emerald Medicare, here with my longtime and wonderful assistant, colleague, and friend, Michele Horton. We are here today to talk a little bit about Medicare, but we're also sort of feeling, spry today because it is the middle of open enrollment, and we are in full gear. Is that correct, Michele?
That is 100% correct.
And so when we're in full gear, we are helping clients all day long, every day, even a little bit into the evenings and weekends.
Yes, that's correct.
So what's keeping you busy these days, Michele?
Well, the phones are definitely ringing at the office. Everybody's calling to make sure their plans are good for the following year. We have people asking questions about their current plans. Can I change? What are the changes? Rate changes? Should I be paying attention to my deductible? What about this specific drug? We try to help everybody answer their questions, make them feel at ease and comfortable and confident that what they have is what they need, or do they need to make a change for the following year?
So Michele and our team of 7 are just working so hard. I am really so proud of them. We've been in business 8 years under my tutelage, and we've been just growing each year. We have almost 2,000 clients in actually 26 states. But the core of our business is certainly New York, New Jersey, Connecticut. And we enjoy what we do. And so we just moved, did we not, Michele?
We sure did. We moved right across the complex. We are in number 6, and it is a big, beautiful office, twice the size of our old office. And we are in and getting settled in and trying to make it our new home.
Well, yes, and I also have the office in Nyack, which I enjoy going there as well. So we cover the county, and we do a lot of different things, and you help me in so many ways, and you really run sort of the team that does so much of the work that has to be done all the time. But, the kinds of clients that are calling, the kinds of questions that are the most on their mind these days. And again, I always talk about all the hype that's in this business. And, we can laugh about it, but it does create all kinds of challenges for us. But what would you say the clients are most interested in talking to you about or most concerned about?
I would have to say, honestly, it's those high-tier drugs that we still have not seen a break in pricing on. Either their patent hasn't worn out, or there's no generics available yet, or, like you like to say, we're not the government and we are not in charge of the pricing, but we try to help people as much as we possibly can. There are programs that help. There are I forgot what you call them.
Well, there's Needy Meds,
Needy Meds,
which is one area. There's the PAN Foundation, which, again, for expensive medications, these are ways in which people can get discounts. There's Good RX. So there's all kinds of
different ways.
All different ways that people can save on medications. And that's, the interesting thing about this year, 2024, that's upcoming, is that there's a limit to the amount of out-of-pocket expenses by a particular individual. And that amount is actually $3,300. So after $3,300 out of pocket, the cost of the meds becomes zero. Well, in previous years, once you got past a certain dollar amount, it was actually a 5% cost. So $3,300 is still a big number, but it certainly doesn't. It does have a limit. And in 2025, through the Inflation Reduction Act, it's actually going to go down to $2,000.
Which is going to be wonderful.
It's going to be wonderful for so many people.
Yeah.
Over the last 3-4 years, one of the big changes that occurred was around insulin costs.
Yes, that is continuing, and it's getting better and better as the years go on. They're putting more and more into the $35 cap rule. We're seeing more and more of those medications being added to that. So it's been really good. It's wonderful for people who really need. It's life-saving. They can't live without it. They need it. They shouldn't have to pay so much money for it. So this is great.
And too often what we hear from people is that they have to make a choice between getting their meds and spending the money on them, or taking less of their meds or going shopping. And so the reduction, especially for seniors on the medications, is really, really important. The other thing is Epic.
I was just going to say that. If
Okay.
you live in New York and you're under 75,000 for an individual and 100,000 for a couple, you can qualify for this wonderful program that's provided by the New York State. It works with your current prescription drug plan, and once you get to a certain point, no medication, no matter what it is, cannot cost over $20, which that really helps our clients who are on these expensive medications. I've had a few people call and say thank you. So it does work, and it's a great program. And if you qualify for it, it doesn't cost you anything. There's no reason why you shouldn't go on it.
So yes, Emerald Medicare. The phone number is 845-358-1220. EmeraldMedicare.com. I was yesterday in Connecticut doing a 2-hour presentation to CPAs. In the evening, I was at the Blauvelt Lions Club, talking to a dozen or so people about Medicare. I love speaking about this topic. Don't I, Michele?
You sure do. It's one of your most favorite things in the whole world to do.
It is, because the truth is that to me, this is all about education. And we don't really have to sell anything to our clients. We're really not only selling, what we're selling is the fact that we are independent. And they shouldn't be calling an 800 number. Because what happens when they call the 800 number, Michele?
Oh, well, they get a bunch of really bad information, possibly, and you're not being told everything that you should know about the plans they're trying to put you in. Sometimes people go on like, oh, that sounds wonderful, put me in. And then they get onto this plan and it doesn't work for them. Their doctors aren't in networks. Their prescription drugs are costing way more than they can afford. So when they come to us, we put them through, all of our checking systems. We make sure that whatever we put you in is going to work for you, that your doctors are in, your meds are covered, you're getting the benefits that you need. And people really appreciate that.
Yeah, people, I feel sometimes, Michele, looks at us as a commodity, but we know, because of the work that we do, we are not. It may come across that way in all the marketing material that's in people's mailbox or on TV, but we take it personally, and we care about these people, and we want to make sure that they're in the right plan.
Yeah.
And if they're not, we want them to call us.
Right. We love our clients. We love all of them. We have favorites. We have people that we each handle individually. I have some that know more about my family than some of my family members do. So it's a really nice, beautiful environment that we've created at Emerald Medicare.
Yeah, we've built a great team, and we keep growing. We just added another local person,
Yes,
Diane. And so we're excited about that. We have a person in New Orleans. We have a person in North Carolina. We have our staff here at 6 Liberty Square Mall, and we're in the Mill in Nyack as well. So we get around this community. Earlier this week, or maybe it was last week, I was at the Presbyterian Church.
Yes, last week.
Last week. And I did a presentation there as well. And again, enthusiastic people, really appreciative of the information. It does seem like people do want to be educated. Would you say that's true?
100%. They are so confused by all that stuff that comes in the mailbox, TV commercials, like you say, Joe Namath. It just doesn't end on the TV, and people say, is that true? Is it too good to be true? They come to us and they ask the honest questions, and we give them honest answers. We don't try to pull a sheet over anybody's eyes, and it's wonderful. And we always meet the nicest people at those events.
It's interesting because when I started the business, everyone was asking for me and wanting to follow up with me. Now they're asking for you. They're asking for Michael. They're asking for Carrie. They're asking for Matt. They're asking for the staff people that have helped them last time. And that is the huge difference between calling our company and calling an 800 number. You're not going to get the same person that you worked with last year.
They always say, oh, Michele, do you remember me? And I always, every time, of course I do. I try to remember everybody. I try to remember just one little fact about something, or they really appreciate the one-on-one, the personal service that we give here.
Yeah, it's the customer service component that I am, I think, in many ways the most proud of. I think that, we've built a team, not necessarily a great team internally, but also externally to the outside world. And I think they feel that we care about them, and, they're stressed.
They are completely stressed and full of anxiety. And then whatever's on the TV and the radio stations and in the mailbox makes them question, or am I doing the right thing? What do I do? Oh, I know. I'm going to call Mark Brownstein's office. They're going to help me. And we do.
We really do. And, it's really nice to be able to see the year-to-year growth, the fact that clients refer business to us.
Yeah. It happens a lot.
It happens a lot. The clients that have used us year after year know that we've been reliable, keep referring their friends and their family to us. And sometimes I don't always remember the individual that was referring to me, but I'm always grateful for the opportunity to service someone who's was pleased with our services.
Right. It's a good compliment back to us.
Yeah, it really is. Well, it's to the whole team. The whole team works hard. And, for us, we have this time of the year, which is open enrollment.
Right.
And this is October 15th through December 7th. So, folks, if you're listening to the show and you have a Medicare plan and you want a question or two answered, you got till December 7th.
Please don't wait till December 7th to call the office.
Right.
Call now. Call often.
Call now. Actually, the good time to call is before Thanksgiving, so that we can get everything done and get everything done on time. Do we have some people calling us on December 6th and 7th? In
Absolutely.
some cases, they
Yes.
do. But
And we do everything we can to help them, even though they're coming in late. We do try to make it happen for them.
We try to educate our clients, and we communicate to them as many ways as we can to please be in touch with us early on.
I had people reach out in July this year. That's how well we have got them trained to know I need to get on that list. I want to be up top. I want to be service first. So it's getting better. Each year we get a little better.
So I have a phrase that I've been using lately, calling bait and switch.
Oh.
And so what's happening in some cases with some of these prescription drug plans that you see in the work that you're doing every day?
So they start off with this, hey, great plan, low premium, great coverage on all your medications, no muss, no fuss. And then next year they've quadrupled their premium, changed all their prices in their formularies. I think that they're hoping that people don't notice the big changes and that they make a lot more money off of unknowing clients and unknowing people. And it's really shameful because there has been a couple of plans this year that's almost quadrupled in premium, which I think there should be some sort of rule against that.
Right. And in some cases, the premiums have gone down.
In other cases this year, we have zero premium plans. We have ones that are for 50 cents. This area, there is one that's $3.70. So we'll just keep an eye on those in the following year.
Right. And 2025, again, as I said earlier, a $2,000 maximum for an expenditure on prescription drugs. My concern, as you've heard me say, is that some medications are going to go down and some medications are going to go up.
Right.
And so there's no way of us knowing that, but the pharmaceutical companies aren't going to lose money based on the government change in the maximum out of pocket.
They'll figure out a way.
They'll figure out a way.
Certainly.
So it's on the heels of the consumer, and that's why I really want people to pay attention. And I talk to planners, I talk to CPAs all the time to make sure that their clients are aware that this is the time to change. So another thing I just wanted to bring up is, there are all kinds of carriers that we do business with. We're checking carriers, we're checking doctors, we're checking facilities, and their prices actually don't change a lot, right?
No.
A lot of zero premium
A lot
plans.
of great zero premium plans out there.
The small changes are subtle.
Yes.
But what do I always say in terms of what do we have to make sure when someone wants to make a change to another carrier?
Is that all their doctors and meds are covered? We
Right.
always do the research.
Right.
Before we put anybody into a new plan, we make sure that they have the coverage that they need for their budget and their health.
Right. And so, those folks who are maybe calling an 800 number or thinking that this great dental coverage or this Part B payback is something that they feel like they have to have, just make sure that your doctors are covered and your meds are priced out properly. Yesterday I showed a chart, and you've seen the chart in my presentations, where a particular set of medications can cost $80 for the year, $400 for the year.
Oh, yes.
They can go to CVS and pay one price, go to Walgreens and pay another.
Right.
And it's sort of shocking for people who are looking at this and just hearing about it, not necessarily engaged in the business, to say, how can that be?
I don't know how it could be, and people just don't realize the differences. I personally feel it should be the same price no matter what pharmacy you go to, including the independent pharmacies that we love so much, especially the local ones in our area. And people don't realize, like, oh, I really want to go to this pharmacy, or I don't want to go to this pharmacy. And the prices do change quite drastically from plan to plan, to pharmacy, and that's included in all the work that we do. We make sure that we're putting them in the lowest cost out-of-pocket plan that we can for them. And we like to give them options of pharmacy. It'll cost you this much at CVS, this much at Walgreens, or this much at Cobblins, or Stony Point Pharmacy, or Schultz, all our local pharmacies, just so they have choices.
And in some cases, it could be just one medication that is priced higher at the independent.
Agreed.
And so that's what
we have quite a few clients who will go to 3 or 4 different pharmacies to get that lowest price at that pharmacy for that specific drug.
Right. And so, these are the kinds of things that, we do that is extra work.
Mm-hmm. But we don't mind.
Yeah,
we like it.
The amount of resources we put to the prescription drug runs are fairly significant.
It's very important. I think one of the most important things about all of the things that we do at our job is the prescription drugs, because that's the most on everybody's mind. Well, how much am I going to pay for this medication? It's not how much am I paying my doctor's visits, or how much am I paying for the dentist, or it's always comes down to the medications, which is critical.
It is critical, and again, because the carriers are changing their formularies every single year,
right.
There's no certainty that the price will be the same.
No.
But at the beginning of the year, speaking of medications,
yes,
there's this deductible.
Oh, yes, everyone forgets about.
So explain the deductible a little bit.
So the deductible is, this year, most of the plans are going up to $545 for your Tier 3, 4, 5, and 6. We've actually seen Tier 6 drugs this year again. Mm-hmm. Once you meet that $545 deductible, so the first time you go in January, it will be costly. But after that, when you go back in February and March, the prices will drop drastically. So people forget. They forget about their Medicare deductibles when they go to their doctor's offices. Why am I getting a bill from my podiatrist? I never got a bill from him before. People forget there is a small deductible that has to be met for your Medicare plans, supplement plans, that has to be met. So people always forget. We get a lot of phone calls about that. Oh, I forgot about that. Oh, yeah, you're right. Thanks for reminding me.
So our season doesn't really end December 7th.
No, not at all.
Our season in open enrollment really ends somewhere around mid to late January, when the questions and all the cards have been received, and they go to the doctor's office for the first time.
Yeah.
And they realize 2 things. 1, the pharmacy and the deductible, and 2, the deductible. So I'm just going to mention a little bit about that deductible. For those folks who are listening who are on a Medigap plan, sometimes people call it Med Supplement, these plans have a first of the year deductible. In 2023, it's $226, but it's still a surprise.
Right.
They're paying their premium of, it could be $200 to $300, and they're paying their premium. And why am I getting this bill? Well, the first $240 of services that are rendered, $226 in 2023 and $240 in 2024. The first $240 of your cost for your care is coming out of your pocket.
Right.
And that's the way these plans are designed. All of them are designed that way, but it is a surprise to people because they think
forget.
Right, and on Plan N, there's a $20 office visit.
So you have to pay the deductible plus your $20 copay.
And so the reason why people go onto the Medigap plan, if they want to go to any doctor they want, anywhere in the country, and they're paying extra for it. Mm-hmm. I will say that in looking at prices in places like South Carolina and North Carolina and other places around the country, compared to New York, they're a bargain. They're $75, right. They're $90, they're $100 a month, where in New York it's $240 to over $300 a month. Correct. For those same exact plans.
Same coverage, same everything. Right.
So another area that is important to clients these days from the calls that you take, and you handle so many calls every day. You amaze me, as does the team. But what other kinds of questions are coming up this time of the
I
year?
get a lot of billing questions.
Yeah.
A lot of bill. Why am I getting this bill? People don't realize that they don't necessarily need to pay that bill. They need to learn how to talk to their medical offices, get appeals put in. I've had a couple of people saying, "Oh, I've been paying thousands of dollars this year," and they're on Plan G. Why would you do that? Why would you pay those thousands of dollars? You don't have to pay that. Your plan covers it. Something's wrong in the doctor's office. Someone hasn't billed it correctly, or someone hasn't serviced you correctly. And I give them the language and the verbiage they need to go back to the doctor's office with and say, question why they got this bill. Just because you got it doesn't mean you need to pay it. So I had one lady who was surprised, and she just sent me a huge stack of bills to look through. But I'm happily doing it for them because it's important. You're paying for these plans. They should be covering your care.
And, today I'm actually speaking in front of a number of the practice managers at Highland Medical, at Nyack Hospital. And these folks are looking to become more educated on Medicare. On the other hand, they deal with billing issues all the time, and sometimes it's, they're not the insurance company either.
Right.
And so they're just processing paperwork. They're putting in codes, and then the patient gets the bill unbeknownst to the medical office. And so it's sort of a twisted web.
It is a twisted web. Medicare is, so I have a background in medical billing with a concentration in Medicare, thankfully. I have seen so many bizarre things happen with billing, and people not realizing that a diagnosis code is really important on that billing with that code, and it really determines if something gets paid or denied. And if your billing office isn't paying attention to what's happening and they're just transferring balances and you're unknowingly paying things, you're spending money you don't need to be paying.
Right, and so that really leads me to the statement of understand the plan that you have.
Right.
Right, and so whether you're on an Advantage plan with a zero premium or a Medigap plan where you're paying premiums but you have a deductible and $20 office visit, understand your plan. Paperwork comes in the mail explaining your plan, but it doesn't mean you necessarily understand all the details. And until you need the service, you don't necessarily know what it's going to cost. So you may have a zero premium plan here in Rockland County, and you are paying zero premium, but that zero premium is a pay-as-you-go. You're paying a primary care copay. It could be zero, it could be $5, it could be $15. You have a specialist. But then you have x-rays and diagnostics, and you have these other things that come up that are all copays.
Right. Sometimes large ones when you have the larger services like that you're not aware of.
Right. Hospitalization and surgery could cost people between $1,000 and $2,000.
Right.
The first 5 days are something you need to pay for. Days 6 through 90, there's no cost. Same for rehab. Rehab, the first 20 days are covered. After that, you're paying out of pocket unless you're on a Medigap plan. So these are sort of nuances within a policy that some people find out when they're in the fact of doing it, when it's happening
or
to
after
them.
the fact.
Or after the fact.
After the fact, and like, wow, why did I get this ginormous bill? So
we try to explain it as best we can. Of course, people don't necessarily remember what we're telling them, but on the other hand, they need to know that they should be able to call somebody. And many of you on this radio line are probably not our clients yet, but maybe someday you will be. And, we give this extra support that you're not going to necessarily get from the insurance company that you call. So again, we are Emerald Medicare. We are a proud team of 7 people working out of Stony Point and Nyack. We really cover very heavily New York, New Jersey, Connecticut, but we're in 26 states. People travel, people move, and we take care of them. We help them in any way we can. We work hard to make sure that people are getting the kind of plan that addresses their health and their budget, and things change every year. And so during the year, we're talking to a lot of people, Michele, who are retiring and who are turning 65. And, how's that different than what the work we're doing now?
Well, they're not as anxious. There's not as many of these questions that come from the TV and the radio and what's in their mailbox. They're just excited that they're turning 65, or they're excited that they're finally retiring. And what does this all mean? And how can you help me, because I don't really know what my options are. This is the first time, like you always say, that you as the individual is actually picking out your health care. It's not being given to you, and you have a say in what you want. And it's very, very, so very important.
So the last thing I want to say, because we're almost at the half-hour mark, is that in New York, which is one of the most beneficial states for being able to make changes. So in New York, if you have an Advantage plan and you want to switch someday to a Medigap plan, and you can afford it, or maybe you need it because you want to go to all the doctors you want, or you don't want any restrictions, there is no underwriting, no pre-existing conditions that happen in the state of New York. For that, it's a little bit of a higher premium than some of the other states that I mentioned, but it's a very unique opportunity in New York and Connecticut, Massachusetts and Maine, to be able to switch from an Advantage plan, low premium, zero premium, to a more expensive, more comprehensive plan. One of the big reasons why people switch to the Medigap at some point is, one, the flexibility of doctors, and also the number of days that you can be approved in rehab. Those are two big issues. But for some people, they just don't want managed care. So, again, there's so many things, Michele, you and I could talk about.
Oh, we could talk all day long.
Right, and we do talk
all day long about it.
And so we really, again, Mark Brownstein, Michele Horton, Emerald Medicare, 845-358-1220, emeraldmedicare.com. Visit the Liberty Square Mall office.
It's
a beautiful
Come
office.
visit us.
The Nyack office is in the Mill. It's not quite as easy to find, but we're in Nyack as well. So thank you all for listening. See you next month. Be safe. Enjoy the Thanksgiving holiday with family and friends. And again, thank you for listening. Have a great day.
Bye.